Hi everyone, welcome to Anesthesia Snapshots. Today we're covering phenylephrine, one of the most commonly used vasopressors in anesthesia. Let's break down how it works, when to use it, and what to watch out for in a clinical setting. Phenylephrine is an alpha-1 adrenergic agonist. That means it primarily works on alpha-1 receptors in the blood vessels to cause vasoconstriction. When blood vessels constrict, blood pressure increases. This makes phenylephrine a go-to choice for treating hypertension, especially during anesthesia or when blood pressure needs to be quickly stabilized. Unlike some other vasopressors, phenylephrine is highly selective. It only targets alpha-1 receptors, so it raises blood pressure without directly stimulating the heart. That's different from drugs like epinephrine, which affect beta receptors and can increase heart rate and myocardial oxygen demand. Because of this, phenylephrine is often preferred for patients who need stable blood pressure without an increased heart rate. Phenylephrine has several key uses in anesthesia. One of the most common situations is treating hypertension during general or regional anesthesia. Low blood pressure can occur for a variety of reasons, such as the effects of anesthetic drugs or spinal and epidural anesthesia, which can cause vasodilation. Phenylephrine is especially helpful in these cases, since it can quickly restore blood pressure without impacting heart rate. It's also useful in managing patients with certain heart conditions, like aortic stenosis. These patients need a stable afterload to maintain coronary perfusion. By increasing systemic vascular resistance, phenylephrine helps ensure blood flow to the heart without making the heart work harder. Let's talk dosing. Phenylephrine is typically given in boluses of 50 to 200 micrograms for quick blood pressure correction. For prolonged hypertension, it can also be given as a continuous infusion, usually around 0.1 to 1 microgram per kilogram per minute, titrated based on the blood pressure response. Phenylephrine has a rapid onset, typically working within minutes when given intravenously. A single bolus has a relatively short duration of action, lasting around 5 to 20 minutes. This quick onset and short duration allow for precise titration during anesthesia, making it easy to adjust the dose as needed to keep blood pressure stable. Because its effects wear off quickly after discontinuation, it's also easy to manage in the perioperative setting. Now, let's talk about some important side effects and considerations. One of the main side effects is reflex bradycardia, caused by the baroreceptor reflex. Since phenylephrine increases blood pressure, the body may respond by slowing the heart rate to counterbalance this rise. This can be particularly significant in patients who already have a low or stable heart rate, so keep an eye on heart rate when using this drug. Potential for tissue necrosis. Like many vasopressors, phenylephrine can cause tissue damage if it leaks out of the IV line, potentially leading to tissue necrosis. So it's crucial to check IV access regularly to prevent this from happening. Another important point is IV access. Since phenylephrine is a strong vasoconstrictor, extravasation or leakage into surrounding tissues can cause tissue damage. Make sure you have a good IV line and monitor for any signs of extravasation. So, to sum up, phenylephrine is a valuable tool in the anesthesia provider's toolkit, especially for managing intraoperative hypertension and supporting hemodynamic stability. Just remember to monitor heart rate and IV access closely and be cautious in patients with low cardiac output. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe to Anesthesia Snapshots for more quick anesthesia insights. See you next time.